reflective log. So you need to get out your reflective log, which has the little Lego right in the front, and your nursing handbook. You will be completing your reflective log on those weeks of clinical that you have patient care. You can also write in it at other times if you want to, but you have to write in your reflective log the weeks that you have patient care. And your reflective log is going to pull together your professional growth, how you're growing as a professional throughout this semester. It is your personal journaling. It's nothing that you're going to get graded on for your grammar or your spelling. And it's nothing that you're going to get graded on if at the very beginning you don't think you're doing such a hot job, because we probably don't think you're doing such a hot job either. But what we're looking for is there growth in the different areas within this log. So if you look at, open your professional or your log to the first page, it asks you, before you begin using this log, we ask you to look up a few things. First of which are the caring behaviors from WCCC. So if you turn to page 34 of your student handbook, you'll see those caring behaviors are listed there. The caring behaviors that we want you addressing are those behaviors of nurturing, supporting, empowering, and accepting. And what you need to do is to make sure that you have a good understanding of what each of those words means. So if we look at the word nurturing, what does that word mean to you when you see that you have to have a behavior of nurturing?
Care for the patient.
Care for the patient. So we're making like this rocking motion, like a mothering kind of caring for the patient. Okay? So we're going to care. And we're going to care for the patient, maybe be compassionate with the patient. We're going to make sure our patients are comfortable. We're going to have a tenderness to our approach. We're not going to go in there and yank them by the ear and pull them out of bed. Okay? We're going to have a little bit of a tenderness to our approach with our patients. We also are going to have a certain sense of protectiveness. We want to keep our patients safe. And this also requires us to be physically attentive to our patients. It requires us to be physically there. Oftentimes as nurses, we are required to do electronic charting. And we end up getting this computer in front of us that we're pushing around on a little cart. And we push it into the patient room. And the patient sees legs and a computer screen, but not a nurse's face. And so we have to remember that we need to get away from that. That when we push our computer in, maybe have it to the side of us. So as we're walking in the room, the patient sees the nurse coming, not the computer. Sometimes they'll say we should put our face on the back of the computer so the patient sort of knows who's coming into the room. So we need to let our patients know that we're there. We need to answer their call lights so they don't think they're all alone out there by themselves. How can we be supportive? How can we be supportive to our patients?
To their wants, emotional.
Pay attention to their needs, pay attention to their wants. We need to make sure that they're aware of what resources they have available to them. Provide them with phone numbers for their pharmacy. If we're being discharged, make sure that their supplies get delivered to their home prior to their discharge. When we're supportive, we're also working to make them have a little bit of self-care. So can they brush their teeth? Can they wash themselves? Can they give their own injections, kind of thing, before they go home? So we're going to make sure that they're able to do that. We also empower people. And we empower people with knowledge. How did you in Nursing 112 empower people? How did you practice empowering? Because you did. How did you do that? What did you do? You did a health fair. And what did you do at your health fair?
Healthy activities.
Okay? You promoted healthy activity. Did you provide education?
We do.
Okay. So you saw a group of people that you provided education to. So you empowered those group of people. Empowering also involves being the advocate for the patient. So we as nurses become the voice of our patient, and we make sure our patient gets what they need. And then we have to have accepting behaviors. And what does that mean to have accepting behaviors?
Just accept them if they're different than you are, they have different culture, believe in different things.
Right, we're gonna accept them if they're different from us in culture, if they're different than us in beliefs. Could we use the words non-judgmental? One of the critical thinking activities we have you do is a diversity tool. We're gonna have you look at differences in people. And maybe here in southwestern Pennsylvania, we don't see a lot of culturally different people as far as people from all over the world living in this area. But I bet we have a lot of people with different social beliefs, with different spiritual beliefs, with different cultural beliefs. We have people with different dietary beliefs. And so we have those here, so they're different, maybe not because they've come from different parts of the world or they speak a different language, but they're different, and as nurses we need to be accepting of that difference. So as you're journaling about yourself, you need to journal how you are growing in these areas of your caring behavior. We're going to have you also work on, if you turn to page 36, we're going to have you work on your therapeutic communication skills. You reviewed these in Nursing 112. You talked again about them in Nursing 114. Okay, so we're going to journal on that. And we also are going to have you journal then lastly on your commitment. Okay? So how committed are you to the nursing profession? And when we talk about commitment to the nursing profession, what we're talking about is, can you follow the American Nurses Association Code of Ethics? Are you able to follow that? If you take your QR code reader and you scan over those little QR codes, what you're going to get is a nursing article that talks about how we can apply the Code of Ethics. We know that there's 9 different points to the Code of Ethics, right? And so we need to make sure that we understand what those 9 different points are in the Code of Ethics. And if we look at the first one, the first provision in the ethics says that we will respect our patients, we'll treat them with dignity regardless of sort of race, creed, or color. Okay? So the article then lets you see how to do that. How do I apply that? How can I put that into my practice? How can I put that in my reflective log? Because I sure don't want my clinical instructor to think I'm prejudiced or anything, but gee, I had a hard time taking care of that guy that was abusing heroin and is now wanting something for pain. Okay? But that's okay. That's okay to write in your journal, to write under commitment. To say the ANA Code of Ethics says that I need to practice non-judgmentally. But boy, this week I had a hard time with that. Because my patient was very demanding and I really don't agree with his lifestyle. And so I had a hard time with that. But that's okay to write in your journal. Because it's okay to express that in your journal. Did you still provide care? Were you still safe with that patient? Were you still respectful when you went in the room? Did you still timely give them their medications that were due? Did you not lie to that patient? So you still provided care, but boy, I struggled with that. Boy, that was hard for me to do. And when I went home, I still was like really fired up about that. I still had a hard time with that. And that's okay to write in your journal. Okay. The second provision of the Practice Act says that we're going to care for patients whether we care for one patient, a family of patients, or that our patient is a community. You've already practiced that because you've cared for a community. You were each in Nursing 112, as a clinical group, assigned a community that you were providing information to. So you already practiced care to a community. Where did you guys go? South Green Gate Commons, who has like an elderly high-rise kind of a thing. And so maybe before you got there, you thought, I hate old people. I can't stand old people. I hope I don't get set with the old people. Great, we get the old people. Okay? So maybe according to the Code of Ethics, you were a little judgmental. But when you got there, you realized that you sort of overcame that a little bit. You were able to work with them. So you provided care to a community. We get a lot of practice providing care to a patient one-on-one. And sometimes in the OB setting, we get a lot of practice providing patient care to a family. We have a mom, we have a baby, and then we have a dad or another significant person that's in that family that all need care and all need taught. Another example when we care for families is often in the hospice situation, where we might have a dying patient in the home, where the family are the primary caregivers, and we as the nurse are coming in not only to assess and care for the patient, but to assess and provide assistance to the caregivers, the family members. So we'll take a look at that. The third provision says that we advocate for the patient's rights. We advocate to do what's right for the patient. We advocate to do what's safe for the patient. One of the things we do is we assess our patients. Right? We're teaching you that. We've had you assess everything you could possibly think of assessing today, right? You did lung sounds, you did heart sounds, you did each other. We had to assess a lot of stuff today. And we do that so that we make safe clinical decisions. If I were to go in and assess her blood pressure, and it was really low, and I would then make the decision maybe not to give her antihypertensive medicine or a medicine that would make her blood pressure go even lower. Because I'm her voice, I'm her advocate, and I'm saying, she doesn't need this right now. I'm going to hold from giving her this. And so I have an obligation to do that as her nurse. What would happen if I gave it to her? I don't care, give it to her. She could die. She could fall. She could become really sick. She could slip into a coma. So as her voice, as her nurse, I'm going to advocate for her so that she's doing things that are right. And then the fourth provision of the Act says that we delegate appropriately. What does it mean to delegate?
Tell other people what to do.
Tell other people what to do. We love that, right? I love telling other people what to do. What's the cardinal rule of delegation? What does that other person that we tell what to do need to know?
They have to be confident.
They have to be competent. They need to know how to do it, right? Could I delegate to my unit clerk, the secretary on my unit, to start an IV for me? No, because that's not what secretaries do, right? Can I delegate to a nurse's aide to turn a patient and position them up on their side? What if that patient doesn't get turned and develops a pressure ulcer? It's on me because I didn't follow through with that delegation. So not only do I have to make sure I delegated the right task to the right person, I have that obligation to follow through with that delegation. Probably this semester, you'll be most comfortable delegating to each other. Sometimes you don't feel comfortable enough to delegate to a staff member yet. Okay? You will. It'll get there. Okay? Remember, you're studying the role of the RN. So the tasks that you'll delegate out are tasks that would belong to nursing assistants. So maybe when you're doing a dressing change on a patient, you may ask one of your student partners, someone that's there with you, can you go get some clean linen for me because when I'm done here, I'm going to change her bag. So you could delegate that task out for someone else to do. So that's when we do delegation. The very last page, if you turn in your reflective log, turn about 2 or 3 pages back, and you'll see a big open square that says a summary of my day. Okay. So at the end of the day, each day you have patients, you're writing in this. So at the end of the day, you're going to summarize your day. I think I did a really good job today. I was able to provide safe care to my patient. I gave all my medications on time and according to how they could be done. But I'm still having a little trouble with the fact that I don't always act non-judgmentally. Maybe I still carry a little bit of a grudge. I'm still not real confident that all these drug abusers on my unit really belong here. Okay. And so that's something I want to work on. Okay. Last night, my husband had my car again. Okay? And he changed the oil and filled it up with gas, so, that was a good thing. So when I got in it this morning, knowing what happened the last time, when I got in it this morning, as I was backing out of the garage, I thought I better put my lights on, because I bet he turned them off. And he did. So I clicked my lights back to auto. But that was something, if I would have written last week in my reflective log, that I would have said, I thought I did a good job driving to school, except I forgot to turn my lights on. So next week I'm going to remember that. So today when I got in my car to back up out of the garage, I checked my lights, knowing that my husband had driven my car last, and I needed to fix that. So that's the kind of stuff that goes in your log. We expect that initially, you're gonna have a lot of stuff in the log, like, I don't feel comfortable with this, I didn't feel really good about myself about this, I still have a lot of work to do in this area, I'm still a little unsure about that. And as you grow through the semester, we expect that your log will grow. At midterm and at final, you'll sit with your instructor. And your instructor will say to you, Cody, show me an example in your log where you've grown in commitment. And he'd say, well, look, mister, week 1, I was doing this. And now that we're at week 5, look, here's how I feel about that now. And maybe it's just a little itty bitty baby step growth. But maybe he had an aha moment. And maybe he's had a bigger growth there. Think of the first day behind the wheel of the car. You know, as you're driving down the street. You figured out how not to do that. And each day made it smoother and smoother and smoother. Hopefully your driving hasn't gotten worse since your first day behind the wheel. Hopefully it's gotten better. Okay? But if you had to journal about your driving, well, today my dad took me out and yelled for 35 minutes while I drove. Well, now my dad took me out and he only yelled for 25 minutes of our drive. Well, I only yelled for 10 minutes of our drive, you know? So how can I show improvement when I'm going through something like that? So these logs will be done every week that you have a patient care. If you do something that you want to write about when you don't have patient care, go ahead. Stick it in there. You can write it in your log. They're in your own handwriting. They can be pen or pencil, pink or blue or purple, we don't care. You're reading them, not me. So when we sit down together to look at your log, I'm going to ask you to show me an example and read it to me. So I don't need to be able to read your handwriting. You need to be able to read your handwriting. So these don't need typed. They don't need collected on a weekly basis. But you should make time in clinical to work on these so that you're not creating homework for yourself. Don't make this, I gotta go home and write that reflective log. As you're there at school, as you get to see these, start putting little notes in there. You notice we gave you some small spaces to write in. We only need you to write small things. Okay? We don't need you to write in 2-point so that you can fit a whole bunch of stuff in those spaces. We need you to make a statement about that. That's going to show us your professional growth. Okay? Questions about that? Okay.